have Dr. MRIDUL TRISAL. Please come. He is going to present on analysis of surgically induced astigmatism after 2.2 millimeters versus 2.8 millimeters incision in phacoemulsification.
Should I start? I'll start. Good morning, everyone. I'm Dr. MRIDUL TRISAL. I'm a third-year junior resident from Subharati Medical College, Meerut. My topic is the analysis of surgically induced astigmatism with 2.2 millimeter versus 2.8 millimeter incision in phacoemulsification. Cataract surgery has progressed from the ancient practice of couching to the modern technique of micro-incision phacoemulsification, aiming to offer the safest, simplest, and the fastest procedure with minimal post-operative astigmatism. The concept of refractive cataract surgery is becoming increasingly significant in the present time. The advancements in cataract surgery techniques have resulted in a notable decrease in incision sizes from 12 millimeter for intracapsular cataract extraction to 10 millimeters for conventional ECCE to 6 millimeters in small incision cataract surgery and currently to 2.2 to 2.8 millimeter incisions in micro-incision phacoemulsification cataract surgery. Smaller incisions offer several advantages like sutureless surgery, enhanced wound stability, and decreased corneal abrasions. It is known that surgically induced astigmatism, SIA, may decrease uncorrected distance visual acuity and require refractive correction, which may decrease patient satisfaction after the surgery. In order to minimize surgically induced astigmatism, reducing the incision size is considered an important aspect. The aim of my study was to assess the visual outcome and magnitude of surgically induced astigmatism in 2.2 millimeter and 2.8 millimeter superior clear corneal incisions in phacoemulsification and to compare and analyze the SIE between the two groups. This prospective randomized interventional study was conducted from February 2023 to March 2024, included 300 patients undergoing uncomplicated phacoemulsification cataract surgery with foldable PCIOL implantation and were randomly divided into two groups, Group A of 2.2 millimeter incision and Group B of 2.8 millimeter incision, both having 150 patients in each group. The study included patients of either gender with senile cataracts, the patient's age being more than 40 years, having preoperative keratometric astigmatism of less than 1 diopters. Slit lamp examination, keratometric measurements, and refraction were performed preoperatively and were followed up postoperatively on day 1, post-op 1 week, 3 weeks, 6 weeks, to assess the visual acuity and the surgically induced astigmatism at each visit. These are the pictures of phaco surgery being done in one of the patients of my study by my guide, Dr. V.K. Malik sir. The results and observations. Distribution of patients was 150 in either group. If we compare the mean age, it was comparable in both the groups and with no statistical difference. If we both the groups had more number of females than males, but there was no difference in between the groups A and B. If we compare the laterality of the eye, both groups had more right eyes, but there was no statistical difference in that. Then when we compare the uncorrected visual acuity between the groups at postoperative week 6, we see that more patients in group A, that is the 2.2, have 6.6 and 6.9 vision, whereas slightly fewer number of patients in 2.8 millimeter incision have uncorrected 6.6 and 6.9 vision, indicating those patients require refractive correction to attain that vision. This is a bar graph showing the similar data. Then we have the best corrected visual acuity. In this we can see both the groups 2.2 and 2.8 have comparable 119 versus 112 patients with 6.6 and 6.9 vision, showing both the groups have comparable visual outcomes. Then if we compare the surgically induced astigmatism between the two groups, we can see from on all post-op days and all follow-ups, the SIA has been lesser in the 2.2 millimeter group as compared to 2.8, and the data has always been statistically significant at all follow-up visits. This is a line chart showing that there is a difference between the two groups, and it is statistically significant at all follow-up visits. If discussion, cataract as the leading cause of treatable blindness in the senile age group in India, and patients undergoing phacoemulsification surgery with IOL implantation have high expectation of early visual rehabilitation, glasses-free post-surgery, and sufficiently clear distant vision. The study involved 300 patients undergoing phaco, comparing the 2.2 millimeter and 2.8 millimeter incisions. Mean ages were similar, and there was no significant difference in gender distribution or eye laterality, which was similar to the studies carried out before. Both groups showed significant enhancements in uncorrected and best-corrected visual acuity post-surgery. The 2.2 millimeter group demonstrated slightly better early visual acuity improvements, though the differences were not statistically significant in the later follow-ups. The 2.8 millimeter incision resulted in higher SIA, indicating statistically significant changes in astigmatism compared to the 2.2 millimeter incision at all post-operative time intervals. The findings of this study provide valuable evidence for optimizing surgical techniques in improving patient outcomes undergoing cataract surgery, emphasizing the significance of preferring smaller incisions to minimize surgical use-induced astigmatism. So in conclusion, we like to say there was no statistically significant difference in age, gender, and eye dominance, ensuring a balanced comparison. Post-operative UCVA and BCVA was similar between the two incision sizes, so both the groups had a similar long-term visual recovery. Our findings suggest 2.2 millimeter incision induced a lesser amount of SIA as compared to 2.2, which was statistically significant at odd follow-up visits, thus reducing the size of incision from 2.8 to 2.2 has a significant effect on SIA. Thank you.
So how much was the difference in actual terms in astigmatism between the two groups? What was the cylindrical power? What was the mean cylindrical power between the two groups? Comparison and significance is different.
Yes, ma'am.
But what was the actual value like?
Ma'am, in 2.2, it was 0.34, and in the 2.8 group, it was 0.57, the mean in the 150 patients.
Which kind of estimate you get after the cataract surgery, like with the wound or against the wound, or what you call with the rule, against the rule? Against the rule. Did you ever apply any the suture?
No, sir, no sutures were applied. All the cases in which complications occurred or sutures were required, they have been excluded from the study.
Did you have any problem entering the incision with 2.2? If your sleeve and everything is normal? No?
So, sir, the surgeries were performed by a senior surgeon, so
Very good, very good.
those were not
Thank you very much.
Thank you, sir.